Hello, everyone. I see people are joining. We're going to get started shortly, but I just launched a poll that would be helpful if you can complete. It helps us get a better sense of our audience for this evening, and we'll get started shortly. We're going to give folks a little bit more time to log in and get situated here, and we'll get started momentarily. I see a few more people are still joining, so I'm going to give us a couple minutes here still. If you have the polling question on your screen, please feel free to go ahead and answer those questions. It helps us get a sense of our audience, so our guest speaker knows who's on the line tonight. All right, everyone, welcome to the Women Grow Signature Education webinar series. Tonight's webinar will begin shortly. I'm going to give about 2 more minutes here. Again, if you wouldn't mind completing the questions within the webinar, this gives us a better understanding of what information might be useful to the majority of the audience tonight. And I will get started in about 1 minute here. Okay, good evening, everyone, and thank you all for joining us. It looks like it's about 2 past the hour, so I'm going to get started in the interest of time. So welcome to the Women Grow Signature Education webinar series. I do see logins of attendees from all over the country, so we appreciate you taking time out this evening to join us. The webinar is being recorded and will be available to all attendees for replay in case you miss anything. Don't frantically jot down notes. This will be sent out to you. And the link will be emailed to the address that you used to register within the next week. We usually try to get it out within a day or two. So I'll go ahead and get started. My name is Fleecy Hubbard, and I am the founder of 510 Wellness and a member of Women Grow. I currently serve as the Director of Education for the Women Grow organization. And for those attendees who may be new to Women Grow, welcome. To give you a little bit of history of the organization, Women Grow was created to connect, educate, empower, and inspire the next generation of cannabis industry leaders by creating programs, community, and events for aspiring and current business executives. Founded in 2014 in Denver, Women Grow is a for-profit entity that serves as a catalyst for women to influence and succeed in the cannabis industry as the end of marijuana prohibition occurs on a global scale. Headquarters are now based on the East Coast, and our chairwoman and CEO is Dr. Shonda Macias. After tonight's guest speaker presentation and Q&A, please be sure to stay on the line for ways to connect with Women Grow and stay on our mailing lists. If you haven't had a chance yet, please answer the polling question that's on your screen. I'm going to end it here in a second and share the results with our guest speaker. This just gives us a better idea of who's on the line so that the information that, that is presented is relevant for everyone. So moving on to tonight's webinar, I have the pleasure of introducing our guest speaker, Debbie Churgai. Debbie is the Interim Director of Americans for Safe Access, also known as ASA, a medical cannabis patient advocacy nonprofit whose mission is to ensure safe and legal access to cannabis for therapeutic use and for research. Debbie oversees all organizational and program operations in regards to education, training, policy, research, product safety, and business compliance. Her current projects include campaigns such as the ACE's End Pain Not Lives campaign and programs such as ACE's Patient Focused Certification or PFC program and the Cannabis Care Certification program, which is the CCC program. She served as a writer, editor, and reviewer on many of ACE's publications, including the Cannabis and Cannabis Resin Critical Review Document and the Medical Cannabis Access for Pain Treatment Report and the State of the States Report, which we are going to dive into this evening. I personally had the pleasure of meeting Debbie several years ago at the 5th Annual Medical Cannabis Unity Conference in Washington, D.C., and I believe that the conference is now in its 8th year. So Debbie works tirelessly on behalf of medical cannabis patients nationwide, and she's really not only an operations genius for the ASA organization, but she truly is a fierce advocate and a real joy to know. So Debbie, thank you so much for joining us tonight. And with that, I will welcome you and turn this screen over to you. I'm going to first give you the results from our poll though, because I know you can't see them. So I'll unmute you here. And our questions this evening were, please select the category that best describes cannabis access in your state. And it looks like 64% of our respondents said that they have a medical cannabis program. 27% have a medical and recreational cannabis program. 9% have CBD only products. And those were the answers for that. So it looks like most people have a medical cannabis program in their state. And then to select a category that best describes their interest in the webinar, 25% are patients. 17% are not patients, but they're interested in learning more. 17% work in the cannabis industry, and 42% have more than one of those choices above. So I will end this and see if I can share it with you just so you have an idea. But generally, medical cannabis program, people, their state is a medical cannabis program, and the answers on which describes their interest in the webinar is pretty varied here, about even across the board. So thank you for joining us, Debbie. We look forward to hearing your presentation.
Thank you, Felicie, for such a great intro. Thank you. As Lisa said, I am Debbie Churgai, the Interim Director of Americans for Safe Access. What is ASA? So if you haven't heard about Americans for Safe Access, the mission of Americans for Safe Access is to ensure safe and legal access to cannabis for therapeutic use and research. We work to overcome political, social, and legal barriers by creating policies that improve access to medical cannabis for patients, researchers, through legislation, education, litigation, research, grassroots empowerment, advocacy, and services for patients, governments, medical professionals, and medical cannabis providers. We were founded in 2002, and we are a 501c3 organization. That means nonprofit. So we are solely funded by members and donors. And we have over 100,000 supporters in all 50 states, territories, and the District of Columbia. I'm just going to talk about a little bit about what we do before I dive into an overview. We have 5 focuses: action, education, policy, consumer safety, and research. And a little bit about what these means: action, impact litigation, voter engagement. We have national campaigns. Education, we have MAA, accredited education for medical professionals. We have unbiased education for patients and caregivers. And what I mean by unbiased, meaning we don't represent any products, we don't sell any products. So we're not just giving you education so you'll buy something. We're giving you education on everything. And we have training for our industry, and that includes dispensing, laboratory cultivation, and manufacturing. We think that if you're going to work in this industry, we want you to be trained on cannabis-specific education. So we include it all. Our policy includes, we've helped to change local, state, and federal legislation all over the country. We are oversight. We look at what's going on nationally as well as locally within the whole country. And we do direct lobbying. We are on Capitol Hill at the Congress every single week talking to legislators. So our advocacy is the backbone of what we do. Consumer safety. So we have product safety standards, development and implementation, regulatory support, and consumer education. I know right now consumer safety is a big issue. I don't want to dive too into it, but right now we have a little vape issue going on. And we've been kind of pushing for product safety for a long, long time. Our product safety program, patient-focused certification, actually started in 2014. So we really have been pushing for that for a long time. We do not believe that banning patients' access to their medicine or to the method of administration is the answer. And we definitely need to let legislators know that it's more about making sure that laboratories are testing throughout the state. Research, we do data gathering, reports and studies, and our partner is the International Cannabis and Cannabinoids Institute in Prague, also known as ICCI. So a little snippet of our website. So everything on our website is free. We are a patient organization, and we really don't want patients to have to pay for things. So we have a ton of free education on our website. I mean, I encourage you to check it out. We have condition-based booklets. We have how to become a state-authorized patient, talking to your doctor, guides to using medical cannabis. We have a little bit of everything, and we've been providing this education since 2002. Just in 2019 alone, here are some of our new resources. We have our medical cannabis briefing book. That is a book for members of Congress that we give to how to federally oversight cannabis. We have a travel guide that we just created a few months ago for medical cannabis patients to learn where, what states have reciprocity, and it gives helpful tips for patients traveling in between states. We have our Patient's Guide to CBD, which is a great resource. And then we have our State of the States report, which is an oversight of medical cannabis programs throughout the country. Those are just our resources from 2019. We have a ton more from previous years, so I encourage you to look under reports, publications, patient information. Another thing we have on our website, which is really helpful for patients, is legal information by state. And so this is an interactive map. You can literally just click on a state and it'll give you all the information. This one is actually not updated. There should only be 3 gray states there, but sorry about that. And this is located on our website. This is just a snapshot of the front of our website, safeaccessnow.org. Like I said, there's medical information, legal information. Under those tabs, there's information for patients, for providers, for researchers, for doctors, for lawyers. I encourage you to look through our website when you have some time. So before I delve into the national overview, I think it's important to give a federal overview. Right now, despite cannabis laws in 47 states, cannabis is still illegal under federal law. We are working to try to change that. That is one of our priorities. The federal government regulates drugs through the Controlled Substances Act, the CSA, which does not recognize the difference between medical and recreational use of cannabis. Under federal law, cannabis is treated like every other controlled substance, such as cocaine and heroin. It is right now Schedule I drug. To give a state overview, so right now we have a patchwork of medical cannabis laws across the state. 33 states, the DC, Guam, Commonwealth of Northern Mariana Islands, the US Virgin Islands, Puerto Rico have adopted laws creating programs that allow some patients legal access to medical cannabis. The word some is very important here because it's really important to note not all patients in these states still have access. There are several issues that I'll go over later, but so even in states that have full medical cannabis programs, even in states that have medical cannabis programs and legalization, some patients still do not have access, and there's many reasons why. Only a minority of states currently include the entire range of protections and rights that should be affordable to patients under law. And each state differs in patient rights and civil protections, access to medicine, ease of navigation, functionality, consumer safety, and provider requirements. These are the 4 standards that we use to create our State of the States report. And I'm going to go over those just a little bit to understand what I'm talking about. So when I talk about patients' rights and civil protections, I'm talking about arrest protections, I'm talking about parental rights, employment protections, housing protections, organ transplants, reciprocity. And I'm just giving you a few of these. There's many more. And these are all located in the report. When I talk about access to medicine, I talk about delivery. Is there access to dried flower? Can you grow your own? Zoning laws, things like that. Ease of navigation, qualifying conditions, that's a huge one. Every state has different qualifying conditions. You can live in one state and be qualified as a patient and cross the state line and suddenly you're deemed not qualified, which doesn't make any sense. So that includes caregiver information, fees, things like that, physician requirements. Functionality, that talks about possession limits, purchase limits. Those are 2 different limits. Allowing patients to medicate where they choose, insurance coverage, that's a huge issue as we know. Consumer safety and provider requirements. We're talking about staff training, recall protocols, product labeling, and required testing. So every state differs in these 4 areas, every single state. And so depending on where you are, it really depends on the kind of access you can have. I'm going to go over this map a little bit more, but this is where our State of the States report started from, just giving an overview of cannabis across the states. And as you can see, this map key, we have 4 different types of states. It was what one of the poll questions was about. So you can live in a state with full medical cannabis program, meaning THC and CBD. You can live in a yellow state, which is a CBD. Some states only allow CBD and very, very limited levels of THC. You can live in a state with a medical and adult use program, and gray states are no medical or adult use program. So here is our State of States report, and as you can see, we have a lot of fun graphics, and I'm going to go over in a little bit and show what they mean. You can find our report at safeaccessnow.org/SOS. So just a few, I think it was last week, I gave a presentation to some South Carolina senators, and so I showed them this report card. This is a snapshot of a full report card. We have one for every single state. So as you can see, it's months of work. And we grade people in those 5 categories, but underneath those categories, like I said, there's subcategories, and there's a lot of them. But not only do we grade the categories, we started something new last year called our opioid response. We wanted to see how states were responding to the opioid epidemic. So we came up with some new categories to grade them on that. But also what we do in this report card, it's important to note this little gray box right here. We give a little background about the state, and in that background, we give some suggestions. I talked about the opioid response. So we have a little paragraph about how to make that a little better in their state. And then new to this year, we did a patient feedback form, which was amazing, and we're definitely going to do that again, and to see what patients were really having issues with in their state. And I will say that one common theme throughout every single state was affordability. And we heard that loud and clear through our patient feedback form. I'm just going to show you a little bit. Here's that gray area up a little closer. So how we advocate and how we use this report is, for instance, when I was talking to the South Carolina senators, so I wanted to have them improve their grade. So how do we do that? Create a system for in-state production and distribution. Include civil discrimination protections for patients. Expand the list of qualifying conditions, or even better, let doctors recommend for any condition they see fit. We really believe that that is the way to do it. And develop strict product safety standards. We also have additional recommendations that I'll go through a little bit later in the presentation if there's time, but we really believe that businesses should get third-party certified. I just recently went to a natural products expo, and it was amazing how important natural products are with third-party certification. I've heard that for years, and I finally saw it with my own eyes that third-party certification is really, it's coming. And so if you work in the cannabis industry, I really urge you to get your business certified. It really helps guarantees products are safe and businesses are compliant. We also believe that staff training is very important to know, so patients can know that, their staff can know that they're working safely and compliantly in their business. We believe in requiring doctor education so that qualifying doctors actually know what they're talking about. And we recommend educational resources for patients as well. And so out of our recommendations, we don't just tell people what to do, we give them the resources. So that's how we created our patient-focused certification, and we created our cannabis care certifications program because we wanted there to be, here's what we recommend, and here is our answer to the problem. So we don't just tell people what to do, we help them find the solution. And right now I'm going to go and I'm going to switch over to the State of the States report just so you guys can we can go through this together. And I'm sorry, I'm going to scroll a little bit, but I think this is the easiest way to look at it. Here is our State of the States report. And I'm just going to point out some things. So boom. First thing we do is we hit you with some really important numbers here. Deaths caused by cannabis, 0. I know there's some people probably trying to dispute that right now with the vapes, but right now that number is 0. States with medical cannabis laws, 47. Medical cannabis patients, 3 million. Just 2 years ago, that number was 2 million. So in just 2 years, that number grew by 1 million. $5 million federal tax dollars spent on federal interference in medical cannabis states before the Rothbacker-Farr CGS amendment. If you do not know what that amendment is, it prohibits the Justice Department from spending funds to interfere with the implementation of state medical cannabis programs. It passed in 2014 after 6 failed attempts. So we were advocating for this for many, many years before it actually passed. And that was the first time that Congress actually voted to protect medical cannabis patients. It was a huge victory for patients. The problem is it actually has to be renewed each year. It's definitely gotten easier, but this is just one of the many things that we advocate for, protecting businesses from federal interference. This is really important. Let's see, 9,000 clinical trial data using cannabis for pain in patient years, 95 plus qualifying medical conditions. As I mentioned, we really think that any condition should be the way to go. 25% average drop in opiate-related death in states with medical cannabis laws. That's huge. 30,000 plus studies published on just the endocannabinoid system alone. 93% Americans supporting medical cannabis. And I urge you with caution on this number, because a lot of people think that, well, everyone supports cannabis, everyone supports medical cannabis. The number is huge, 93%, right? But if you actually ask someone, do you support it in your neighborhood? Do you support it with your family members? Then that number changes a lot. We find that with legislators. Oh, sure, I support it, but just not in my state. So we urge you with caution. It's an exciting number that so many people support it, but in what way do they support it? Do they sign on to legislation that supports it? You know, that's an important question for us. Well, if you support it, why don't you sign on to some legislation? 165 million federal prescription drug cost savings in medical cannabis states in 2013. Amazing. 103 plus known cannabinoids, over 70,000 deaths caused by prescription drugs in 2017, and 126 million plus number of Americans suffering from chronic pain, which is actually the #1 use for cannabis, but I will show you that statistic later. I'm going to go down to, here is our opioid response. I said we added this new, so we added a few scores for this. Our End Pain Not Lives is our national campaign for making cannabis an option. As you know, cannabis can be an option for pain treatment. However, a lot of people still don't know about that. So what we're doing is trying to educate people that it really can be an option, and sometimes a much safer option. Here's a good chart right here. As I mentioned before, most frequent medical condition for medical cannabis recommendations. Look at this, 66.6% chronic pain. We kind of made a joke about the devil's weed with this number when we saw it. But yeah, 66.6% use it for chronic pain. The second most being muscle spasms. Right here, I'm going to blow this up, don't worry. This is our condition list. So to show you a little bit how crazy this is, you can find this on our website under Safe Access Now /condition. Here's our key. I'm not going to go through this, but it'll explain it. Here is an Excel, and you can click on this on our website and find this information. Here's an Excel of every single condition and whether it's qualified in states. Look at this. Look how long it is. And as you can see, some states have any qualifying condition. But look at all these white spots. Look at all these gray spots. So many, people do not have access just because of their their condition. And it's crazy. So you can be right here in one state, you know, DC, happily along with issue. And then if you cross to another state, suddenly you're not qualified to use the medicine. It's crazy, right? So that, we used to have this in the report and it actually just got too big. So we had to take it out. As I mentioned, here's how we graded each report card on these 5 issues. And if you want to know more about these 5 issues and every single subcategory, there's over 50 of them. We have that as well. It's under safeaccessnow.org/rubric. And it goes over every single category and subcategory, and it explains every single one. So if you have a question like, what does that mean exactly? It is here on our website. We actually used to have this in the report as well, and it's got a little too big. So we have a timeline, and what's really interesting about this timeline is I just want to show you federal raids: 14, 241, 262, 2. That's amazing, right? But it's really important to know that these federal raids did happen. I heard someone recently, they saw a video of a federal raid and they actually kind of laughed and thought that it was like someone made it up and it was dramatic. I mean, it really isn't. If you ever have time to Google a federal raid of cannabis, it is really scary. I mean, very, very scary. I actually couldn't look at some of them because there were kids involved and things, and I got really upset. So those things actually really happened. And so it's important to know the history. If you're going to be in this industry, it's really important to know the history of why patients are fighting for this, why advocates are fighting for this, because we've gone through a lot. There's some maps that show also, you can see the how many states have programs. And so it's getting there. We're getting there for sure. But like I said, access is still a problem in many of those states. We have a chart on the medical use of cannabis. It explains all the delivery methods. It explains cannabinoids and terpenes. Definitely look at this if you want to learn more about what terpene does what. And here's a little chart about just the opioid epidemic again, and prescription drugs and cannabis and how many deaths per year. So these next few sections, the online version does have the whole rubric. So I'm going to skip that, so we don't need to go to all that, and just go to the report cards. Sorry about that. Oh, this is another great graphic, medical cannabis program regulation and oversight. I'm sorry, it's a 2-pager. But this shows how medical cannabis is regulated. And this is a great graph that we use for legislators as well, because sometimes they don't understand how it's regulated. And so it's really important to show this graph to them so they can kind of understand. What's important to note is every patient needs to talk to a medical professional in order to get to be qualified. So now, as I mentioned, here is a bigger picture of that state map. If you can see, there are a lot of Fs. And so we have a lot of work to do here. There's a lot of states are getting, higher grades, but there is still so much work to do. So I really encourage you, if you are lucky enough to be in one of those states that has access or that has an A and a B, there's still problems in those states too, trust me. But I really encourage you to look at, to think about the whole country, because there are still so many patients that are suffering. And so it's really important to continue to advocate and to continue to educate people on this issue. If you have, family and friends in any of these states, it's really important to remember that this is not just a local issue, it's a national issue. So here's all the states, and like I said, we have a report card, 2-page report card for every single state. I'm not going to go through all of them, but I will show you here at the end. And please, you know, take a look at your state, but also take a look at other states that you're, like I said, your friends or family are in, because they're important too. But here's a really good map as well. So this map shows the concentration of patient populations. And if you look here, you can see, obviously, California is most of it. But remember I said that number, 3 million patients across the country? But most of them are in these blue states. So look at this country. And some of these states have medical cannabis programs, but there's still those problems with access. There's still those problems with you know, limitations, or there's still the problems with methods of administration allows, or condition qualifications. So even though a state can have a medical cannabis program, it doesn't mean that everyone in that state can benefit from it, unfortunately. So this is really important to just kind of highlight that we still have a lot of work to do here. We still have a lot of work to do. I'm going to go down here to our grade distribution. So as you can see, 17 states received Fs, but a whole lot of states received Cs and Ds as well. So, I mean, only a few states actually received As and Bs, and even they have, you know, could use some help. But we still have so many states that are not doing a great job providing for patients. Here is our chart where you can see every single state grade in the last few years. So you can see how your state has progressed, or if it didn't progress, because there are states that went down. But it's also important to see that a lot of these states that have progressed, it's because of the recommendations from this report. So important to let legislators know, not just that there's issues in their state, but how to solve those issues. So a lot of these states, look at this, Oklahoma went from an F to a B. Amazing, right? So this is a great chart to look at if you want to see how your state has progressed or not progressed. As I talked about, ACE's role in shaping legislation, these are just a few examples of how we helped. And so we're still working on several states. If you don't see your state here, it doesn't mean that we didn't help. We're definitely helping. These are states that have improved their grade from suggestions that we gave. So we also include universal improvements and model legislation. Like I said, we don't just tell people they have a problem, we try to find the solution and we create the solution. So we actually created model legislation to help. For instance, there's problems with insurance coverage, huge issue. As I mentioned, that was the #1 problem that we received patient feedback from. And so we want to do something about it. We also, delivery is an issue. So, you know, legislators don't understand that many patients cannot go to a dispensary. They're not physically able. Delivery is very important. So opioid prescription trade-in, something that we had been talking about for a long time, and then finally Illinois started where you can exchange your opioid prescription for a medical cannabis card. You do not get the cannabis, you still have to pay for the cannabis. But as you know, in many states, you have to pay for the card, and some patients cannot even afford that. So that's, you know, just helping patients where they don't have to pay for things is really helpful. I'm going to go down to delivery, as I mentioned, also a very important issue. So we have this language, and we do present this to legislators all the time. Civil protections, huge issue. Increasing cannabis education. Like I said, we have these programs that help. And then we have recommendations to legislators. So we have, like I said, we created these PFC and CCC programs to help regulate in a way that is best for patients. And so we really want to help regulators do the right thing. Of course, the federal government's role is very important as well. We actually created an Office of Medical Cannabis Control. It's a way to have the federal government regulate medical cannabis. And we created this legislation and created ways in which the different departments could help with this. So this is really important. I encourage you to read this if you're interested in federal legislation. And that is the end of our report. I'm going to go back to the webinar. Or the PowerPoint, sorry. And talk a little bit more about some of the things I mentioned. So as I mentioned, we have education and training programs. Our patient-focused certification, I'm just going to talk a little bit about this, is our third-party certification program. It was created to address issues of quality control and product safety, specifically for the medical cannabis industry. That's important to note because there are some other third-party certification programs, but this one is specific to medical cannabis and cannabis in general. We do all businesses. These are our partners in our program. So we do work with, the ACS, American Chemical Society, APA, American Herbal Products Association, the American Association for Laboratory Accreditation, the American Herbal Pharmacopoeia. We work with all these in ICCI, all these organizations. What PFC does, we do third-party business certification, but we also do medical cannabis training, as I mentioned. We think that a trained industry is very important. And we don't just train dispensary staff, because there is a lot of dispensary staff training out there, but we also do cultivation, distribution, and manufacturing and laboratory. And through, how this can help is reduces company liability, employee and management training. We implement product safety protocols, adverse event reporting, recall programs. These are some of the training programs, courses: Cannabis as Medicine, Business Operations, Understanding the Law. I think that's very important if you're going to work in any part of the industry to truly understand the law. State and legal compliance training. So we give you state-specific training. Unfortunately, every state has different regulations, so we had to create a different training for every single state. And then our National Cannabis Standards training, which is in the areas of cultivation and processing, distribution, manufacturing, and laboratory. So 4 different areas. You don't have to take them all. You can pick which one, or you can do multiple ones. I'm going to talk about our Cannabis Care Certification Program a little bit. This is our medical cannabis education program for patients and caregivers. And we always think caregivers are just as important in this program. They take good care of patients. So we want them to be educated as well. And then also medical professionals. There's 3 different, on the Cannabis Care Certification website, there's 3 different sections you can go to. If you're a patient and caregiver, you can go to that section. And we have a training program, which I'll talk about in the next slide. We also have a medical professional program. So if you're a medical professional, you want to go over there. And then we have companies and organizations where dispensaries can actually buy unlimited access up to this patient training, unlimited access, and then give it to patients for free. So here's our patient education course. And like I said, this course, we try to do, this is the only thing that we actually have that costs money for patients. And this is a different website from our ASA website, but it's only $49. However, if you can see, I created a special code. So Women Grow is the code, and you will receive 20% off the patient and caregiver course. Please use that code in the next few months. I think it'll be active until December. And so as you can see, the patient side of our program is really, it's actually 9 videos. I don't have them all here, but they're each about 10 to 15 minutes long. Some of them are even a little bit shorter. So they're really easy to use, really easy to view. You can watch one, or you can watch 3 of them, or you can watch them all. It's 2.5 hours of videos all together, but you don't have to watch it all at the same time. Our courses are over here, as you can see. We do a little bit of everything. We also offer, as I mentioned, AMA accredited CME credits. And these are not just for doctors. As you can see here, the accreditations are for physicians, nurses, nurse practitioners, pharmacists, and psychologists. They are accredited for all of those. You must use this code though, CCC 2019, in order to get full access to the program, because we do partner with the answer page. So you will be taking the course through the answer page. However, you get the access to everything only by using that code, CCC 2019. So we give doctors not just the CME credits, but we also give them free access to the patient and caregiver section, because we want them to see what patients are learning about and to recommend it to their patients. You know, unfortunately, we're living in a time where doctors can't educate us on everything that we need to know. So we do encourage patients to get educated as well. Like I mentioned, we've been around since 2002, and I was going to originally try to put some ASA accomplishments here, but honestly, the list is so long that I really just couldn't fit it in. If you really want to be amazed, I encourage you to go to safeaccessnow.org/accomplishments and see everything that we've done since 2002. It's really amazing. So as I mentioned, we are a member-based organization. We are only as big as our biggest group, and so we encourage you to please join as a member if you can, because as I mentioned before, our accomplishments are not just our accomplishments. Our accomplishments are due to our members. And so if you're a member, you can sit here and say, you know what, we did this, because we literally cannot do anything without our members and supporters. Basic membership is only $35 a year. That is a year. So we really encourage you to please join. If you're unsure if you're a member, please reach out to us. But you will also get a membership card in the mail. So if you don't have the membership card, you might not be a member, but we really do encourage you to help us spread this education by becoming a member. As Felicie mentioned, we have our National Medical Cannabis Unity Conference, and yes, it's the 8th one coming up. And this is definitely a different conference from most, because it's actually for patients. It's a patient-focused conference. We have a huge scholarship program in which we bring about 100 patients from all over the country who normally wouldn't be able to afford to be able to fly to DC to talk to their legislators face-to-face. So we pay for 100 scholarship recipients from all over the country to come. We give them a day of learning, a day of education, and then we teach them how to lobby. We teach them how to advocate if they don't know. And then we have a full day of a press conference on Capitol Hill, by the Capitol in downtown DC. And we give them, anyone who signs up for the conference will get you a meeting with your state legislators. And so you can go in groups. You know, you don't have to go alone. You go with a group of patients, and you get a chance to talk to your state legislators face to face and share your story. It's so powerful. I encourage you, if you're a patient, and you don't have to be a patient, you could just be a concerned citizen. You could just be a supporter. And just share your stories and let people know why this is so important. As I mentioned, we also have our End Pain Not Lives campaign. If you're interested in learning more about this or supporting us through this campaign, please check out safeaccessnow.org/endpainnotlives. And then lastly, I just want to say, you know, please sign up for our monthly newsletters. Those are, you know, free. We only put them out once a month. We don't want to bother you too much. or follow us on Twitter, Facebook, Instagram, and LinkedIn to give, so you can know about, new resources that we put out. And we do put out a lot of resources, so feel free to follow us. And this is my information. Please feel free to contact me anytime if you have questions, if you want to know more about how to advocate in your state. I mean, I'm definitely happy to help you. If you want to know more about our programs, contact me anytime. And that is the end of my presentation. So now I think if anyone has any questions.
Thank you so much, Debbie. That was such a really unique dive into both the progress and I guess pitfalls of programs nationwide. And I gotta say, I feel like I'm pretty up to date on what's happening with ASA. And you mentioned so many things that are available on the website that I had no clue about. So that was a really very comprehensive review in a very short time. So thank you for that.
Thank you. Yes.
I want to also say, to our listeners, for those of you that are in the industry and you do public speaking, I have often referenced ASA's materials online for presentations that I've given, also just for community education sessions, that kind of thing. They really have a very, very robust offering of materials that are free to use, and they really put a lot of work into this. So thank you again, Debbie, for really taking the time to do a dive into that. And I hope that some of our attendees will take advantage of those resources.
Yes.
So we definitely got quite a few questions in. Let me pull them up here. I also want to say kudos to you for addressing South Carolina directly on their F. I'm sure that was not an easy day of talking, but you've got to walk the walk and talk the talk, right?
Absolutely, yeah.
So one of our first questions was, will ASA provide speakers to legislators of cities or states if someone wants someone to
Yes, someone just emailed me about that the other day. Yes, absolutely. Anytime. We love to talk to legislators. And so if we can't do it, we will find you someone. As I mentioned, we have supporters and members and advocates all over the country. And so there are many times where certain states, I'll say, I know exactly who you should talk to. And so definitely we have connections everywhere. We would love to do that.
Great. And then the model legislation that you mentioned, are there local or regional organizations that you work with specifically to get those to local lawmakers, or how does that process work with the model legislation?
So we attend a lot of functions where there are state legislators. One of the ones that we went to where we actually announced our State of the States report was the National Conference of State Legislators. So we gave hundreds of these reports out to state legislators all over the country. It was amazing. So we do try to go to events where there will be a lot of people, but we also have our chapters. Our chapters are a huge resource for us. I didn't mention this on the slide, but we do have chapters all over the country. And if you are looking to join a chapter, please look on our website. All the contact information for all the state chapters is on there. But we really do rely on our chapters to spread this information to legislators. Also, if you do sign up for our email list, what we do is we send you template emails. And so when things are going on at the state level, and it will just send it to your state with letters to sign on that you can send to your state legislators, and you don't have to worry about writing it yourself. We'll give you the template, and you can easily just click on it and send. So you don't even have to send it yourself. It'll send it to them automatically. So yes. I encourage you to sign up for our email list.
Yep, I've done that as well. It's easy as pie. You can edit it if you want to, or you can send it straight away. So that's a wonderful resource. And it's nice that it's state specific also.
Right. Yes. And you can make it personalized to yourself. You can definitely change it.
Mm-hmm. And then someone just asked, what's the difference in types of membership? Is that something that they can ask their local chapter, or is that on the website?
Yeah, as in one of the slides, basic membership is $35, but there's also different levels of membership. And depending on what type of membership you have, you might have different benefits. For instance, I don't know if many people know, but if you are an ASA member, you get 10% off. I think it's 10, might be 15. I'm sorry. I should know this. The training. You get 15% off PFC training. And also, we are doing something I can't talk about yet, but we are also trying to get some more big benefits for discounts across the country on products, because as we know, affordability is a big issue. So membership does have benefits, and we're trying to increase those benefits. So depending on what kind of level you're at, it really increases the level of benefits that you receive. On our website, you can kind of see there's a section that says members only. So if you're a member, you can click on that link and it'll show you.
Yeah, and I also want to just reiterate, the membership fees I think are pretty low for what you get as a member. It's also a nonprofit, right? So yeah. Is your membership fee tax deductible? Or
it is. Everything, yep, very good question. Everything that you donate through us, including membership fee, is tax deductible. And I do want to mention, I didn't say this, but on the website, there's also a business sponsorship where for as little as $250 a month, you can be a business sponsor. And that means you're going to be listed on our website and you'll be sponsored to several of our events. And so I encourage you, if you are a business, to please encourage your organizations, companies to sponsor us. It's really helps us. We really cannot do much without donations and membership.
Wonderful. Okay, and then you did also mention, again, everybody, you will get this recording. If you're anything like me right now, you're frantically taking notes, but this will be recorded, so you'll be able to reference it later. But thank you, Debbie, for the PFC and CCC codes. I didn't realize that we were doing that, but you do the patient focused certification. That really is a very generous code to use, the Women Grow code. And then for the cannabis care certification, I actually did that program when it was first launched, and it really is a wealth of information that you can share with even family and friends, or if you're in the industry and you're an advocate and you do community education, it really is a great resource to use for that. So those discount codes, I'll make sure that we include that in our mailing when we send out the recording here. But I believe it was Women Grow, and that will be active through December. And then you said the CCC was CCC 2019, is that right?
CCC 2019 is just for the medical professionals.
Okay.
And that is active all the time. So that is the code that anyone must use in order to get to that special program through the answer page.
Wonderful. Okay, and then you can, for those of you that are patients that are listening, this is a great way to try to encourage your own, private practitioners to participate. I think a lot of times, patients are up against physicians that are not educated in cannabis at all and don't really know where to start. This is a really wonderful resource to share with them so that they have some level of education as well. Let's see. There was a few questions specific to dosing. Is there information? So one of these questions is, how do I figure out how to take what amount of medical cannabis and keep functioning, driving kids to school, responding to emergencies, etc.? Is there information that's specific about dosing and personal use on the website?
So one thing we really don't delve into is dosage, because everyone is really different. And that's the only thing I can say, is that everyone's different. So we don't want to give you recommendation, but what we do say is, start slow and try to find your right dosage. And there's also some apps like Relief app that you can use where you can monitor your dosage and monitor what you're using and how much you're using to help you find what is best for you. But unfortunately, dosage is part of like a legal advice, and so we can't delve too much into that.
Sure. Okay. And then I really found your qualifying conditions Excel sheet really interesting. I personally have had many conversations with folks in different states that are just concerned about, you know, some qualifying some states have 2 that are just really kind of random, some states
Right.
very robust that have, you know, 10, and it's really, you know, you went through chronic pain being the #1 qualifying condition. Is there anything that people can do specifically to impact their state's qualifying condition list?
I think advocating for no list is really the most important thing. Like I mentioned, there are so many, even under, by the way, even under chronic pain, there's actually several different qualifiers under just chronic pain alone. I just want you to know all these right here are, oh no, there's so many different chronic pain that you'll just see throughout here. So it's not just like chronic pain, it's chronic pain due to this, chronic pain due to that. So even just under chronic pain, there's a lot of diversity throughout the states.
Mm-hmm.
But so we really think, unfortunately, I mean, for us, the only way is to just say, let medical professionals determine what is right for their patients. Let patients determine what is right for them. I don't think that having a condition list is the way to go. I really think that it should be for anything that's deemed necessary.
Mm-hmm. Well, wonderful. So I want to be mindful of our time. I think I covered most of the questions that folks asked. If you have questions that I didn't see or we didn't answer, please feel free to email Debbie or email Women Grow, and we'll try to get you an answer. Again, I really can't stress enough how wonderful of an organization Americans for Safe Access is, and how many really wonderful free resources they offer. This is honestly, and I'm not saying this, Debbie, just because you're on the line with us here. I have referred people to the ASA website time and time again, and it really, your work is not going unnoticed. So thank you for everything that you're doing for patients nationwide. And thank you all for joining us tonight. Again, you'll have access to this. I will be sharing it in the next couple of days. Feel free to share it with colleagues and friends and family and your physicians. We want to end the stigma here and get folks educated. And for Women Grow, we do definitely encourage you to keep up with Women Grow and stay in touch with us. Our website is womengrow.com, and you can find us on social media at Women Grow. We have this signature education webinar series is offered at least once a month. We try to cover topics of interest, and most of them are free. So please do keep an eye out for what topics are coming up and stay connected with us. So thank you again, Debbie. I really appreciate the time that you spent with us tonight, and for all of our attendees, thank you for taking the time out to join us.
Thank you.
Everyone have a great evening.